Advantages and limitations of supraglottic airway. Advantages: fast insertion, as I said, minimal training is required, hands-free ventilation. What are the limitations? It does not fully protect from aspiration, as we discussed earlier. There is a risk of gastric insufflation, and there is a risk of trickling of the gastric secretions into the perilaryngeal space, and there is a slight risk of aspiration, and it is not a completely definitive airway without any. It is, you cannot completely maintain this patient for a longer period of time on supraglottic airway device for ventilation. You have to, this is just like a bridge, which is endotracheal intubation. So it is just a placement of tube across the vocal cords into the trachea is called endotracheal intubation. This is what is a definitive airway, because you can maintain ventilation on the through a ventilator or through anything, through the ambu without any risk of aspiration, because the cuff is inflated. This will prevent aspiration, and it is a definitive airway which you can maintain for a longer period of time, unlike supraglottic airway device, right? So this is what is endotracheal intubation. So the indications: altered mental status, protection of airway, anticipated clinical deterioration, failure to oxygenate or ventilate. So when you are planning for an intubation for any patient, you always have to have a checklist in the mind whether all these are there. Any of this is not there, you would prefer waiting for these to be arranged and then only start the intubation process. Because why? I'll tell you the importance of each aspect of it. Suction. So once you put your laryngoscope inside, there is an increased risk. There would be already secretions, there would be some blood, there would be anything in the oral cavity which would obscure your view of the vocal cords where you have to intubate, right? So that's why suction is very much important. Second thing is oxygen. So oxygen supply is anyway important. You are doing ambu already, and sometimes you also check the ventilator is connected to the, because once you intubate, you ventilate the patient through a ventilator. So whether the ventilator is having the proper oxygen supply or not, or the ventilator is connected to the oxygen supply or not, is what you have to always check. And airway devices. As we said, when the intubation is failed, you have to always check whether there is an oropharyngeal airway and supraglottic airway. To rescue your ventilation, you have to check. Next, pharmacy, which is drugs, like the induction drugs. It would be ketamine, which would make the patient deeper, sedate the patient. Second thing, or midazolam, the drugs. The third one is muscle paralysis. It would be succinylcholine or a rocuronium, which would be required to completely relax the muscles, induce muscle paralysis to allow you for intubation, is also one other aspect which you have to check before going ahead for intubation. Next is monitoring. As usual, the monitors which are already connected, you have to recheck the position of all those. And endotracheal tube, oscillate, the video laryngoscope, whether also the laryngoscope, all those are working or not, which you have to recheck before you go ahead for intubating any patient.